Hey, Dr. Grizz at 918 Chiropractic, and if you've been following us for very long, you know for a fact in our clinics, we don't touch a patient without an x-ray, and it's because of this reason right here. This is a patient who's been seeing a different chiropractor, had been a part of a franchise at a low-fee model, being adjusted a lot, but nobody knew what was going on. Patient wasn't getting better. You might notice as you look down the spine here that looks all intact except for that big gap right there. Yep. That's a broken back. It is literally fractured 1/4 of an inch. Wait for it. I actually had this patient bend forward. And as we zoom in, you can see that how much that segment slides forward. Not only does it slide forward, do you see the gap that was created there? And then it's going to go backwards. It closes down. You see it close down and it slide back. This is an unstable segment. I can't treat on this patient as I would a normal patient. I'm telling you that because if you are currently seeing a chiropractor and they didn't look at your spine, they didn't look at the x-rays, I know for a fact they don't have x-ray vision, maybe just curious about what's going on. What we do in our clinic is this on purpose. I didn't adjust her on the first visit because if I'd have pushed on her spine, you can imagine what would happen. That would slide off. Her spinal cord lives in that. I could cause more damage than I could cause good. What I want you to take from this is really look into your healthcare provider. Are they doing the necessary testing? Are they doing the things that you feel comfortable with because you're the patient? As a doctor, guess what you get to do? When you hire a doctor, you do that. You hire them and you fire them. I've been hired and fired before. It's an okay thing. If it doesn't fit my model, that's okay. But I'm going to tell you right now, if they're not doing clinical, evidence-based showing your x-rays, you might want to look for someone else. I'd like to apply for the job. We've got 2 offices, and that's not for us. That's not for me. But what I want you to know is question everything, because if you're not getting the result you need to see, maybe there's some testing that needs to happen, and maybe there's been something that's missed. Broken low backs, broken necks. I've seen them, all those different things, and all it took was a picture and someone that took the time to analyze the picture, ask the patient to come back so he could give them a good, healthy report. Dr. Grizz at 918 Chiropractic. Take a picture of your spine. To see is to know. Everything else is a guess. We don't guess in our clinic.